The next speaker comes from Long Beach, is a leader in the Filipino community. And throughout this whole COVID pandemic, it's been horrible how healthcare workers have been at the front lines, and many have sacrificed their lives. Jelaine is a registered nurse who works for the public health department in Long Beach, and she's going to address some of that and speak about how AB 1400 will literally save the lives of her community and colleagues. Jelaine, please give her a hand.
Thank you. I just want to say I love being in this kind of space. I haven't been in a multicultural space like this in such a long time. But I'm glad I'm here. But please bear with me because I haven't done this in a long time. So good afternoon again. My name is Jelaine. I'm a registered nurse, and currently I work as a public health nurse for the city of Long Beach. I'm also a founding member of FAWA, which used to be Filipino American Healthcare Workers Association, now also known as Fostering Aid Through Health Workers Alliance. So this nonprofit raises funds to support and conduct medical missions and educational trips to various countries around the world. So I was invited to talk about the experience of Filipinos and Filipino Americans under the current healthcare system. Some may not know, but everyone must have noticed when you go into a health clinic or to a hospital that a lot of healthcare workers are of Filipino descent. It has even been a running joke that if you're a Filipino, then you must be a nurse. But the impact of the COVID-19 pandemic on the Filipino healthcare community is definitely not a funny joke. According to National Nurses United, over 3,200 healthcare workers have died in the US. More than a quarter of those who have perished were Filipino. At the health department where I work, when the pandemic hit, most of the nurses there were reassigned to COVID response. One of my tasks was to follow long-term care facilities or nursing homes and help them manage their COVID cases and outbreaks. COVID first really hit home when we had our first healthcare worker death, a nursing supervisor in one of our nursing homes. This was sometime in July 2020. He was 29. He was 29 years old and he was Filipino American. It hit even closer to home when my own brother passed away in September of 2020 after being in the hospital and on a ventilator for a month. He was a healthy 60-year-old and also a healthcare worker. He was a licensed vocational nurse, or an LVN, who used to work for the LA County jail system as a nurse. COVID does not care whether you're 29 or you're 60, but has definitely impacted certain communities more than others. And after almost 2 years, even though the number of cases have been lower recently, we have not yet succeeded in ending the pandemic. Needless to say, the current healthcare system we have in the US and here in California has failed us. It has failed all of America. It has failed especially those who are already marginalized because of their social status. It has failed people of color, Native Americans, Blacks, Latinx, Asians, and Pacific Islanders, etc. It has failed immigrants, working people, our mothers, fathers, brothers, sisters. It has failed our families. I used to be an ICU nurse, but when I started working in public health, I better understood why my patients end up in the ICU in the first place. Sometimes they keep coming back, and we called them the frequent flyers. Pre-pandemic, I used to visit the homes of chronically ill patients and try to help them navigate the system. It's a difficult job because it's a broken system. I've seen the lack of access to quality healthcare services, especially among immigrants, the homeless, the unemployed, the undocumented, most of them people of color. Many of our patients have not seen a doctor in years. Without us, they won't know what to do to address their health concerns. But there's only so much we nurses can do. As much as we would like to help our patients get care, a lot of times it's impossible under a broken system. Even before the pandemic, it has always been complicated, difficult, and many times impossible to receive quality health care for many of us. The pandemic may have opened our eyes to these disparities, but nothing will change unless we create the change together. AB 1400 aims to provide free, equitable, accessible, multicultural, multilingual, quality health care to all Californians. This is a step in the right direction and may possibly be a blueprint for other states to follow to fix this broken healthcare system. Health is a human right, and everyone deserves a healthcare system that truly serves the people. I urge you all to call your legislators now and support AB 1400 for Filipinos, for Filipino Americans, Asians, and Asian Americans, for your people, for our people, for all of California. Like we say in our language, makibaka, wag matakot. That means dare to struggle, do not be afraid. Thank you.
Thank you so much. Thank you so much. Let's give Jelaine another hand. And repeat after me. Maki baka. Say it. Maki baka. Okay? Maki baka. All right. I didn't. Some of you may know that members of PANA, Progressive Asian Network for Action, we've been out 4 times to Kaiser Sunset because the nurses there don't get enough PPEs at the beginning. They had to go out and fight and stop work to demand PPEs. Can you believe that? That would not happen with AB 1400, no way. Okay? The hospitals would be required to have them. Not only that, but there's a provision in AB 1400 that says that hospitals and nursing homes, you can only make so much profit. You can't make profit by cutting back healthcare. That's a first in the nation.